Okay, now we're going to talk about different types of instrument sterilization delivery methods. This is a Genesis tray. It can be called a rigid container or a casket. It's used to put instruments in and send it through the sterilizer. So the instruments inside of this would be sterile once it met all the parameters of sterilization. So this is what gets sent up to the OR that has your instruments. So we want to make sure that this is still sterile. There are several things that we can look at that will tell us if it's sterile or not. First thing is external indicators. So this has a little locking tab, this little white tab. It has a little circle. It's half black and half white. When it's sterilized correctly, this will be half black and half white. Before it's sterilized, it's all white. They're locking tabs, so if these are gone, that means that maybe someone has opened this tray already. So you want to check your locking tabs first. A lot of times it'll have some type of paper with tape on there, and the tape will be an indicator as well, where it'll have diagonal lines on it that turn black when it's sterilized correctly. So you want to make sure that the lid is seated all the way around. It's not coming off. You can look into the top and see if that filter is placed correctly. Or sometimes you'll look in there and there's not a filter. Then that tray is not sterile. So the next thing you do, once you confirm that at least the external indicators indicate that it's sterile, is you open your tray. You don't want to open it away from you where you're going over the sterile field, the sterile instruments. You want to pop it, which is just lifting this handle on both sides. Now it's ready to come off. What I'm going to do is I'm going to roll it back towards me, away. That way, at no time was anything unsterile hanging over those sterile instruments. So now, I'm going to take my tray and I'm going to check my filter. This lock comes off. I'm going to look at this filter and I'm looking at it. I'm checking for moisture and holes in this filter. If either one of those are found, then this tray is not sterile. So that filter was good. So now I have a tray that's ready to open. My scrub would come over here. Let's say I'm the scrubbed person. They would come over here. They would look for an external or internal indicator, which is a strip like this that has a little indicator that turns black when it's sterilized properly. They're going to make sure that they don't see any gross contamination of any instruments. They're going to make sure that the instruments, the jaws are open. So just different things like that will show you that it was sterilized correctly. Then they're going to reach in without touching the sides and lift the tray out, and they'll step away and hold it. While they're holding it, you're going to check this bottom filter that's in here. Not every tray has a bottom filter, but if it does, you need to check it. You check it just like the top one. Undo the latch, pull it out, looking for holes and moisture. If that's good, then your scrub can take their tray and put it onto their sterile field. All right, this next type of tray is wrapped in what we call a blue wrap. So this wrap, the steam can penetrate this wrap, or whatever type of gas they use. It can go in there and sterilize the instruments that are within this. Usually there's a tray inside of this, but we want to open this in the correct way, and we want to verify that the external indicators tell us that it's sterile. My external indicator on this would be the tape. This has already been opened several times, so the tape is kind of broken, but there would be tape that's holding this blue wrap folded. And the tape is an indicator tape, and it has these white stripes that will turn black once it's sterilized correctly. If I saw this tape with the white stripes, I would not use this tray. It was not sterilized correctly. For training purposes, we're going to say that, okay, it's got black stripes. I'm going to open it. So I want to open away, to the side, and the last one towards me. And now there's a sterile tray in there that your scrub can come and get. So what they would do with this one is they would pop the top, hand it off, and they're looking for that internal indicator that tells them that this tray was sterilized correctly. The indicator's in there and this one hasn't changed, so if that hadn't changed, I wouldn't use this tray. I would send it back down to be reprocessed. But for training, we'll say that it was, so the scrub will take this, lift it up, step away. The unscrubbed circulator will take this wrap, and they are checking and then looking at this wrap for moisture and holes, just like the filters. If it has a hole in it, then it's not considered sterile. You're looking for moisture because it may indicate that it wasn't sterilized properly, and that could be an issue with the sterilizer itself, that it didn't evaporate that liquid. And so that's kind of a big deal. You would need to escalate that, just following whatever process you have at your facility.